This episode is brought to you by Cora tampons. Made from 100% certified organic cotton, every Cora product is made with pure and ethically sourced ingredients. No pesticides, no fragrances, no bleach, no BPA, no synthetic materials. If you're still using conventional tampons, we need to talk. You don't even know what you're putting inside of your vagina. Head over to fertilityfriday.com/Cora today, and you'll receive your first month supply free of charge. This is the Fertility Friday podcast, episode number 141. Welcome to the 141st episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Hi, ladies. I'm so excited to be here with you today. I have a great show. Today's guest actually was a recommendation from one of the members of the Fertility Friday community. So today I am sharing my interview with Nicola Rinaldi, and she's the author of the book, No Period, Now What? In today's episode, we talk all about hypothalamic amenorrhea and what some of the causes are that you may not really think of. It may not be the first thing that comes to mind when you, if you've experienced amenorrhea, whether it's post-pill or just in general, where your periods have stopped coming and you're really trying to figure out why that has happened and, how to bring them back, of course. I think one of the really important things that comes out in today's interview and a number of the other interviews that I've done is that very real need to acknowledge that your period is a really important indicator of your health. It seems like in our grandmother's day or in our mother's time, we had more of an understanding that having a regular period was just a really important part of being a healthy woman. But in today's day and age, all of the media around periods and all of the commentary around it has caused us to even question if it's necessary to have one. And for me, that's terrifying because from my vantage point as a fertility awareness educator, I see it. I always say, your charts won't lie. You really can tell a lot about your charts. For instance, I've had a number of clients ask me, maybe they're trying a different diet or they're, changing their nutrient ratio or they're changing their exercise routine. And they really want to know, is this good for me? I read that this is something I should try. And my response is typically, well, we'll see in your charts. Your menstrual cycle will really reflect back to you how healthy you are in a number of different ways. And so although some practitioners may tell you that it's not that big of a deal if you're not getting your period, which just boggles the mind, and that really, the pill is the solution to that, just to get everything regular, which we know by now that the pill isn't actually regulating anything. It's really important to take that as a sign from your body that something's going on. Your body can't communicate to you in words, so your body has to communicate in its own ways. And so if we pay attention to our menstrual cycle, that's really a way for us to connect with our bodies and start listening to what's happening. And so, if you've been recently learning to chart and you've had some struggles figuring it all out, I would love to help you and support you in that process. It's what I do. I take clients through that process of charting to really help them get down the basics. And then once we have the basics down, then we start to delve in deeper and ask the really important questions to help us figure out if there is something wrong, what could be at the root of it. So I would encourage you to check out my programs on my Work With Me page. So you can just head over to fertilityfriday.com/workwithme. And if you have questions about the programs that I offer, or if you're wanting to figure out if it's a good fit, then make sure to book your free 15-minute consultation with me and on that page. And so again, that's fertilityfriday.com/workwithme. And before we jump into today's interview with Nicola, just a short word from our sponsor, Cora Tampons. I remember the first time that I learned about what was really in my menstrual products, and let me tell you, it really grossed me out. Ever since then, that was many years ago. I think I was probably 19 or 20, kind of right around the time I discovered all of this great stuff. But I remember the first time, and I didn't know that my pads and tampons that I was buying from the store contained pesticides and chlorine, bleach, and all kinds of different toxins. And I didn't know that the materials that were inside of these products were essentially engineered to be hyper absorbent and had potentially harmful effects. And so if this is all new to you, I would encourage you to go back and listen to episode 135. That's the episode that I recorded with Molly Hayward, the founder of Cora tampons. And in that episode, we go into more depth about some of the health challenges that can arise. So many women notice that by switching from conventional tampons and pads, they will see a reduction in their pain with periods, or even an improvement in their menstrual cycle parameters. And, I've spoken a lot on the show about xenoestrogens. And so if you're still using conventional pads and tampons, switching over to a healthier alternative that is free of pesticides and chemicals is one really important way to reduce your exposure to xenoestrogen chemicals. So Cora tampons are made with 100% organic cotton. So not only are Cora tampons free of pesticides and different toxic chemicals, it's also, made with completely natural materials. So no synthetic materials. And what I love about Cora is really they're manufacturing their products with you in mind. They really want to keep you safe and healthy. So make sure to head over to fertilityfriday.com/Cora. And when you sign up, you actually get your first month's supply free of charge. So again, that's fertilityfriday.com/Cora. Now let's jump back into today's episode. And today I'm very excited to welcome my guest, Nicola Rinaldi, to the show. Nicola is the author of the book, No Period, Now What? A book that came out of her own experience trying to conceive over an 18-month period. After receiving a diagnosis of hypothalamic amenorrhea, Nicola spent hours on research and using that knowledge to work on her own recovery. She tried the medical route to pregnancy with multiple doctors' visits and injections and ultrasounds, and that didn't work out the way she had hoped. And ultimately, she was able to achieve a natural pregnancy. And that is the motivation for her book. So I'm really excited to talk more about her today about that. And today we're going to be tackling hypothalamic amenorrhea and busting some myths around it and really delving into the research that Nicola found in her own process. So without further ado, welcome to the show.
Oh, thank you so much for having me, Lisa. It's wonderful to be speaking with you. I've really enjoyed your natural fertility podcasts, and it's something that's very near and dear to my own heart. So I'm super excited to be talking with you.
Well, thank you so much for being here. As I was telling you in our pre-chat and when we spoke before, it was one of my listeners that recommended that I have you on the show, and I'm so happy that she did. And so I'd love for you to share with us a little bit about your story and how this book came about. What all started this?
So really what started it is I was in graduate school doing my PhD and starting to think about having a family. And, I was sort of doing a little bit of reading, and I read in a lot of places, lose weight to be, more fertile and ready for pregnancy and, to have a healthy pregnancy. And so some of my lab mates were like, okay, we're going on a diet. I was like, oh, I'm going to do that too. I need to lose some weight. And, never mind that I was in a perfectly fine place. I did not actually need to lose any weight. But, society tells us that we have to be super skinny and lean and whatever. And so I was like, yeah, I'll do that too. So I started restricting my calories. And at the time I was exercising a lot because I loved what I was doing. I was playing ice hockey and volleyball and squash and lifting weights and biking and playing golf, which sounds like a ton, but it was all stuff I was doing for fun. And my husband was a consultant, so he was away a lot. So, I had all the time in the world during the week when I wasn't in grad school. But I went off the pill about a month after I started restricting my calories, and I didn't get my period. I was like, that's funny. What's going on here? And, in hindsight, restricting my calories while I was doing that exercise was the worst possible thing that I could have done for my body. And it was basically saying, hell no, you're not getting pregnant like this. I mean, what are you thinking? There was so little information out there at the time about anything like that. And it was, like I said, it was all lose weight to have an easy time getting pregnant. And so that was what was in my head. And I thought I was doing the right thing. And then, like I said, I went off the pill and I didn't get my period. And so I went to see my doctor, and she was like, oh, well, sometimes it takes 3 months. And so, let's wait 3 months and see what happens. And so I continued along essentially the same path. And 3 months later, I still didn't have a period, again, no surprise in hindsight. So then I started looking into it a little bit more, and she started doing some tests and suggested, oh, maybe you should eat a little bit more, and your exercise is probably fine, but maybe cut it down a little bit. So I started trying to do that. And it took about 6 months before I was actually officially diagnosed with hypothalamic amenorrhea. And then I started seeing doctors, and they were like, oh, you're not going to cycle naturally. Let's just do injections to get you pregnant. So I did 4 cycles of injectables while continuing to exercise. I was eating a bit more by this point, and I gained some weight, but not back to where I had started. And all 4 cycles failed. It was a really dark time in my life. I felt like I was never going to get pregnant. I was never going to have kids. And, at the beginning of my journey, I was like, oh, if I can't get pregnant, that'll be fine. I have a good life. And when I was actually staring it down the face, I was like, no, I'm so not okay with that. So we were going to do IVF as a sort of next step down that path, but had to take some time off for insurance reasons. And throughout this, I continued to sort of cut my exercise and slowly gain weight. And during the couple months that we took off, I actually ovulated naturally, and I was doing ovulation predictor kits because I figured, hell, I might as well do something while I'm waiting. And so I got a positive, and we hit the bedroom, and 2 weeks later, I got a positive pregnancy test. So it was just amazing. Like, I can't tell you how astonished I was to see the positive OPK, and then to actually get pregnant on that very first cycle. Amazing. And then after that, I ended up going on bed rest during that pregnancy because I was having Braxton Hicks contractions like it was nobody's business. And during that time, I found a message board online where women were talking about hypothalamic amenorrhea. And so I joined the message board because I had plenty of time at this point and started posting about the research and my story. And I really loved helping other women to understand what their doctors were saying and to understand the condition and kind of work their way through it and figure out what they needed to do to recover, because there was so little information available at that time. There's a lot more about it now, but even so, it's hard for people to know what they really need to do because there's so much conflicting information. You still read in a lot of places, lose weight, as if that's going to be the panacea for all things. And in fact, especially for fertility, that's not always the answer. So I think I'll end there.
Well, there's so many moving parts to your story. So I do want to unpack it a little bit. So you had been on the pill for how long up until this point when you went off of it?
That's a difficult question. I think I went on the pill at about age 17. And then I was on Norplant for 5 or 6 years and stopped getting my period on the Norplant, which I think is a fairly common side effect. And then I went off Norplant and because the 5 years were up or anything and back on birth control. So I think it was a total of about, from when I was about 17 to 30-ish. So about 12, 13, 14 years, something like that.
Okay. And so you had started your kind of exercise weight loss regimen before you came off the pill. Is that right?
Yes. Yeah. And that's a good point because when you're on the pill, it completely masks anything that your natural cycle is doing. So there are a lot of women who I think end up in the same situation. They undertake a new exercise regime or start eating less while they're on the pill, and they continue to bleed because that's what the pill does. And so they don't know that they're having this impact on their cycles.
Mm-hmm. Well, and then, so you came off of the pill, and then in total, how long did it take before you ovulated naturally?
So that's a little bit of a complicated question because I actually did get one period about 8 months after I went off the pill. But I was already seeing fertility doctors at that point, and I went in for an ultrasound and had a 13-millimeter follicle. So I was completely stoked. I was like, yes, my body's doing this on its own. And then I went back for another ultrasound 2 days later, and they're like, oh, it hasn't grown, so let's just do injections. And knowing what I know now, I'm like, oh my God, I can't believe they didn't just tell me to wait a week. It could have saved me so much heartache. But they didn't because, that wasn't in their heads. And so I went down, did those 4 injectable cycles. So that first period was in March, and then I ovulated naturally in December. So another 9 months later, when I finished, after I finished those 4 injectable cycles. And yeah.
Okay.
So it's a complicated story.
Yeah, no, absolutely. So that's like that 17, 18 months before. I'm just piecing it together so we can get a really clear picture of what's happening. Of course, with my fertility awareness educator brain, I also want to know, just because it's important to kind of put the pieces together to really get a sense of what was happening in your story. Mm-hmm. And what I think is really interesting is that in retrospect, you kind of look at that information that you heard and really put together for you that the kind of over-exercise piece was playing a huge role there. Let's talk about that. I've seen it in a number of different ways in clients that I've worked with. And I mean, of course, as a culture, we look at exercise as healthy. Like if you're running for an hour, 6 days a week, you're considered to be a star.
And I definitely think that it is, but in moderation, I think the high intensity exercise and exercising every day and never taking a break, I'm not so sure that's healthy.
Well, I'd love to hear what you found in your research. How do we know how much is too much and how much is okay in terms of exercise?
Well, I think tracking natural cycles is actually a really good indicator, because for many women that I've worked with, there are signs in their cycles of issues, either anovulation or short luteal phases, that can be signs that the exercise they're doing is too much. And it's certainly true for me. I've tracked many cycles over the years, and there's a very strong correlation between adding exercise or the intensity of my exercise and the length of my luteal phase. So a great example is after my third son was born, I was doing much less exercise than I had in the past, because now I had three. And it took a few months after he was born before I really started exercising again. And my luteal phase was the longest it had ever been after he was born, because I was not exercising. And then as soon as I added exercise, it dropped from 12 days down to 7. So for me, that's a really good marker. And I think that that's something that people could track if they're not on birth control pills, because obviously you don't have a luteal phase when you're on birth control pills. I think it's also really important to take rest days when you're exercising. I mean, we have this idea that if some exercise is good, more exercise is better, but our bodies just aren't built like that. They really do need to take some time off to repair those muscles that are getting torn down every time we're exercising. And so I think that's also pretty key whether you're training for something or whether you're just, doing exercise in general.
Well, I'm so glad that you said that, because from my perspective, you really can see in the menstrual cycle how exercise or any number of different factors affect your menstrual cycle. And it's really interesting. I shared an interview with Dr. Dennis Wilson several months ago, so I'll link it in the show notes page. And he spoke about this, and it was absolutely fascinating, the connections that he made. So in the research that he's done, how sometimes you'll notice that a person is exercising regularly. So we'll pick on the runners. Running is an exercise where you're kind of exerting about the same amount of energy throughout your workout, right? Like, so if you were looking at it on a chart, it would probably be a straight line, because when you're running, you're just kind of like, running at the same level of exertion for the whole time kind of thing. And so in his research, he showed that what happens, and I think a lot of women and men can attest to this as well, is that at first you start losing weight when you start incorporating that type of exercise routine. But eventually you get to a point where you no longer lose weight, and sometimes you even start gaining weight. And that doesn't make sense, right? Because you're exercising all the time. So why would you be losing weight? So I think it's really interesting, because he points out that the type of exercise you do is as important as the exercise itself. I know that you speak about in your book the 5 factors that play into hypothalamic amenorrhea, because the exercise piece isn't the only piece. But would you like to talk a little bit about those factors that I guess set the stage for women to lose their periods and how those interplay with each other?
In my research, there are 5 main factors that play a part in a woman losing her period. And it's a different combination for everybody. And it can sort of be, you can take one factor to an extreme, like somebody with anorexia, for example, that's an extreme level of underfueling. And that alone can cause a missing period. Or, for example, if there's something super stressful in your life, like the death of a very close family member, that can cause somebody to miss a period. Or, really intense exercise, like all of a sudden jumping up and starting marathon training can cause you to miss your period. But for most people, it's not any one factor to that extreme. It's a combination of elevated cortisol from high intensity exercise, underfueling to some degree, whether intentional or not. Sometimes people don't even realize that they're not eating enough to support their exercise, because studies have shown that while people who exercise do eat more, they don't necessarily eat enough to support the amount of exercise that they're doing. And then often it's in combination with stress. So whether it's work stress, or a lot of us are sort of type A perfectionist overachievers, and we put a lot of stress on ourselves just naturally wanting to be the best at everything that we do. And all of those factors can kind of combine for somebody to lose her period. And in my case, I think it was the stress of grad school and the exercise. I think those two alone would have been fine, but it was when I added in the severe caloric restriction that my body was like, nuh-uh, this is not going to happen. And there's certainly research to back up all of those. And, all that research is laid out in my book with references and everything. People don't have to take my word for this. They can go and look at the original research studies themselves.
Well, so you touch on, even from the very beginning of the show, when you were sharing your experience, you're touching on some really pertinent issues that affect most women at one point or another in their lives, which are the idea and, really big challenge of weight loss, and that balance between the information that we're told. So I was just speaking to a woman today who told me that her doctor basically told her she should lose weight because she's, a certain number of pounds overweight type of thing. So how do we know when, like, it's like a 8-parter, right? Like, how do we know when we do need to shed some weight? How do we know when potentially carrying extra weight could negatively impact fertility? But then beyond that, how do we shift our perception of the appropriate way to go about weight loss? Because I feel like the idea that our culture has about weight loss is that we're supposed to restrict our calories and then like kill ourselves in the gym. And studies show that doesn't work anyways.
Right. I've been listening to a lot of podcasts and doing reading on this whole idea of weight loss and health and, how it's all integrated. And everything that I have seen says dieting doesn't work. There are so many studies that show like, this number of people lost weight, but it's only 5%. And if you look at them 2 years down the road, most of them have gained it back, if not more. And so I think that doing anything for the specific goal of losing weight is, it's really hard in the long term for that to work. I think what needs to happen is just, an overall look at your lifestyle, and is your lifestyle healthy or not? I mean, if you're eating McDonald's every day, that's probably not the healthiest thing in the world. And, maybe you should be cooking at home more or getting just more whole foods and that kind of thing. But making changes specifically to, with the idea that, okay, if I stop eating carbs, I'm going to lose weight. And, doing anything like that sort of as a wholesale change and depriving yourself, it just doesn't seem to work. And, this is not really my field, but it's just something that I've been paying a lot of attention to recently and trying to learn about. And, there are a lot of great podcasts out there on this topic and health at every size. And so I'd really encourage your listeners to check some of those out, and, really dig into the research and learn more about, all of this, because it seems like we have kind of genetic weights, and we're so encouraged by doctors and society to, that everybody has to look the same, and that look has to be essentially prepubescent. It's not reality, and it's certainly not helping fertility. I mean, prepubescent girls aren't fertile, so why are we trying to look like them,
Yeah. Well, I know one of the factors is weight and BMI and body fat. And so I'd love to hear a little bit more about that because you need to have a certain degree of fat on your body to conceive. And what I find interesting is that the friends of mine and women that I know who have actually undergone fertility treatments, their doctors told them to stop working out. Like they were about to go for the IVF and their doctors, so they know this. This is in the research. And so they, you know, a particular friend that comes to mind, she was getting a little frustrated because she started gaining weight, you know, but she was told to stop working out by her doctor, her IVF doctor.
Specifically for IVF, the doctors do usually say to stop exercising because your ovaries get so big because of the overstimulation. They can basically twist on themselves and cause like major damage. So that's why they say to stop exercising specifically for IVF in a lot of cases. Because I know so many people who have gone to doctors and said, look, I'm exercising an hour a day. And the doctor's like, oh, that's great. And, you know, for that particular person, their BMI is often on the low end of normal. And they're often restricting either their overall calories or they're on low carb or low fat diet, and they're exercising daily. And as we talked about, the mix of all of those factors just isn't going to allow them to A, cycle naturally, or B, even have a great chance at responding to fertility treatments. So you mentioned the BMI thing, and a lot of women will look at the BMI range and say, okay, 18.5 to 25 is quote unquote normal. And so I'm at an 18.3 and that's perfectly fine. And I don't really know where that normal designation came from because for fertility purposes, certainly I find that under 22 to 23 is generally not great. And I would encourage women who are having any type of fertility issues who are below that to consider eating a little bit more, exercising a bit less to try and gain some weight. And, then women who are above that are often encouraged to lose weight. But there are a lot of studies. I don't really see, strong evidence for like 25 being the cutoff for healthy. I mean, I think it really has to be a more individual take on what a person's lifestyle is like and their overall choices, and not so much about those numbers, because there's so many different factors that can play into your actual health, and especially your reproductive health. And just looking at BMI is not particularly useful.
Well, and when you mentioned, I wonder, where that number comes from and all of that. My guess would be, and I don't know if it's right or wrong, but I would imagine that would be the kind of male standard, but not specific to fertility.
You might very well be right.
Yeah. And so it's kind of like, well, that's what's good for men. So let's just assume that that's also what's good for women, regardless of whether or not they're trying to conceive. And let's just use that, which is kind of the way that the world works.
Yeah, that's a very, very common pattern. Yes, exactly.
Well, and let's talk a little bit about stress, because I've spoken a lot about stress on the podcast, and stress is it's like a harder target. It's like a moving target. If you're trying to hit it, it's a little bit harder to really quantify it, because, a lot of my clients struggle with this as well. I mean, you identify that your job is a stressor. You can't just quit your job. So,
right.
Like you were in grad school, you couldn't just quit grad school. So then what do you do?
Like, it's easy to say, okay, you should eat this amount and you should cut your high intensity exercise. Stress, though, it's so individual. What one person perceives as stressful, another person can have no problem with. So the things that we recommend sort of for dealing with stress are taking time to yourself every day, maybe listening to a meditation podcast or doing yoga or something that's peaceful and not focused on taking care of other people, because I think that, that for a lot of us is where a lot of our stress comes from. And clearing out social media can be helpful. There can be a lot of stress associated with the comparisons that can come from that, and certainly some of the political stuff these days. And like you said, stress is a really, really difficult one to deal with, especially when you want desperately to be pregnant. was relaxed when I started this process, and now it's been, 12 months or 18 months. And so, yeah, I'm not exactly as relaxed about it anymore. And having you tell me that is not helpful. My mom said that to me as I was going through this process, and I was like, I was relaxed at the beginning, and that did not help me get my period. I needed to eat more and exercise less. People think of that as a panacea, but it's not. And it's, as you say, it's really, really hard to do. So, another thing that I think can be helpful is finding other people who are in a similar situation to you. For me, when I was going through this, I was blogging because there was, like I said, there was no information out there about hypothalamic amenorrhea at the time. And I came to find some very good friends in the blogging community that I'm still in touch with, 12 years later. And then the online support group that I joined, many of us have been in touch for almost 10 years now. And, I think the support that other people can offer, understanding the situation that you're in and commiserating, and, I think that can be helpful.
Well, and let's talk a little bit about the under-eating component of it as well, because I have a podcast as well or a different episode with Lily Nicola. She came back on the show to talk a little bit about under-eating, because you would think it would be the other way around. Like you would think if you were, say you were a student and you're in some sort of profession where you're going to start working with clients, you would think as a clinician that the problem would be that people are eating too much. And as you work with women, often I've certainly asked the question to clients of mine, which is, where's the food? Where's breakfast? Like, what are you eating breakfast? Is this all you had for the day? So I would love to hear your take on this, because under eating is a lot more common than I think people would realize.
Yeah, I mean, it kind of goes back to what we were talking about before, where there's this huge pressure from society, sort of every angle, that, we have to be thin and losing weight, and, your body is never good enough the way it is. And so I think that leads many of us to just consistently undereat and, feel like we're doing what we're supposed to. And the truth is that it decreases your overall metabolism. And certainly for fertility purposes, the further you take that under eating, the more it's shutting down your hypothalamus and therefore your reproductive cycles. I was actually just listening to another podcast with Matt Stone. Have you ever heard of him?
Mm-hmm.
He wrote the book Diet Recovery, and it's well worth a read. It's a free ebook on his website. And, he talks about sort of how this constant under eating is affecting our metabolism on a daily basis. And eating more doesn't necessarily mean you're going to gain weight. It means you're just going to rev up your metabolism, so you feel healthier and you feel more energized. And, I think particularly when women are trying to get pregnant, that's really important. To make sure that you are eating enough and you're not in a caloric restriction every day. It has marked effects on our hormones on many levels, because there are hormones that are secreted in your stomach as you eat, depending on how much you ate and what types of food you ate. And, our bodies are remarkably good at keeping all of that in sync if we let our heads get out of the way and, just kind of follow our body's cues.
Well, and I think what's so interesting about the research around caloric restriction is that not only does it decrease your metabolism at the time, but even after they have their participants begin eating normally again. So let's say normal is 3,000 calories a day, and they have their participants go down to 1,500 calories a day for a period of time. And then they, eventually have them eat the 3,000 again. Like a year later, their metabolism is still low. So even after they've resumed their normal activities, the metabolism continues to be low. And that's your body's way of adapting to starvation, because that's what your body thinks you were in a famine. And now it has to hang on to the calories to prepare for the next one. So.
Yeah. Yep. Yeah. Although in women who are recovering from HA, I feel like their metabolism does sort of restart and get back to the levels that it was prior to weight loss. I mean, so for me, I started at a certain weight, and then I lost a lot in that first month when I was restricting my calories with all the exercise I was doing. And the place where I ovulated and got pregnant was a few pounds higher than where I started. And I think that's common, that when they lose their cycles, that the point at which they regain them is right around that, right around the weight they were when they started losing weight, or maybe a little bit higher, because like you said, our bodies need to feel that extra reassurance that we're not going to go and starve them again.
Yeah, that's really fascinating. And I think it's so important to make that connection between losing your period, because something that struck me when you were talking about your experience is that none of your practitioners seemed particularly concerned about the fact that you didn't have a period. It was like, well, I guess you just can't ovulate. Let's give you some drugs. But from my perspective, when you think
and that is so common.
Well, it's the foundation of our medical system. But when you begin to look at your menstrual cycle as an indication of your overall health, I talk about on the podcast since the very beginning that the menstrual cycle is the 5th vital sign of your health, if you know how to read it. Mm-hmm. And so when you lose your period, it's a pretty clear indication that something's up. And all of those injectables don't figure that out. They don't change the underlying issue. And so I love that you really kind of break it down into what some of those factors are.
Yep. And, as you say, it is so common for doctors to say, oh, you don't have your period, no problem. That happens to athletes. When you stop running so much, you'll get it back, and it just really treat it as no big deal. And I just think that there are so many repercussions, short-term and long-term. I mean, in the short term, you probably feel cold because your body's doesn't want to spend its energy on keeping you warm. You might have brittle hair and nails. You probably get upset really easily, the whole hangry thing, hungry, angry. And so those are sort of short-term effects. Oh, and no libido, and, not to mention not being able to get pregnant. That's kind of a given. But then there are also the long-term effects of, bone density issues. And there are some studies that suggest that there can be cardiac concerns, both in the short term and longer term, although those are restored by restoration of your menstrual cycle. And also even potentially a greater propensity to dementia when you're in your later life. And, it's hard for doctors to look at you now and say, oh, well, we need to take care of this because of things that might happen 20 or 30 years down the road. But, I love that you call it the 5th vital sign, because I could not agree with that more. That's so true. And I think that, the idea that birth control pills make up for it is so wrong, because those synthetic hormones do not give you the same protection that your natural hormones do. Because, in your natural cycle, you've got estrogen, progesterone, LH, FSH, you've got the inhibins, and probably more things than that. Those are sort of the major players. You don't get the same effects from progestin and whatever the estrogen synthetic thing is. So from the research I've looked at, the birth control pills can maintain bone density in somebody who has hypothalamic amenorrhea, but you don't gain bone density as you should through the earlier years of your life. And even in girls, I looked at a study recently of girls who did not have HA but were on the birth control pill, and their bone density increases were not as much as girls who were not on the pill. So it's like we're giving this thing as a Band-Aid, and it just seems like there are negative health effects that are not being taken into account, both of not having your period and of giving people birth control pills. I understand using them for contraception, maybe, but out considering all of the repercussions and really informed consent, in my opinion.
Yeah, I couldn't agree more. And that could be the start of the longest tangent ever in the history of tangents. But I'm not going to take that. But one of the things, so to kind of, because I couldn't agree more. There are a lot of side effects. And I feel like, I did an interview. It was really interesting with Dr. Miranda Naylor. So she's a medical doctor, family physician, and she had her own experience with this very thing. She went off hormonal birth control and she didn't get her period back. And the last time I reached out to her, she still hadn't got it back. And it had been, I think by now, about 2 years. And so she was faced with this.
Oh, wow.
Yeah, as a medical doctor, finding that there's nothing in medicine to help her figure this out, And so, that's when she found the podcast and she reached out to me, and that's why I invited her on the show. But she shed some light as to why doctors make the recommendations that they do regarding hormonal birth control, because ultimately in their training and teaching, they're not really advised of the 100, 50, I don't know, side effects that are associated. They're really just advised of the kind of big ones, the ones that could kill you. And then that's about it. So that's its own issue. One of the questions I did want to ask you, a lot of women struggle with PCOS. And so one of the characteristics of PCOS is that you can go long periods of time between ovulation, between having a menstrual period. How would one tell the difference? How do you know if it's hypothalamic amenorrhea or PCOS?
HA, it's easier.
Thank you. I'll be doing that.
So I actually have a whole chapter in my book on HA versus PCOS, and I think it's so important that I have it available as a free download from my website, because there are three factors that are typically considered in diagnosing PCOS, which are: one, missing or very irregular cycles, as you said; two, ovaries that have a lot of little follicles when you do an ultrasound; and three, signs of hyperandrogenism. So that's sort of excess male hormones, and that can be manifest either in blood work or in some physical symptoms like excess hair in places where you might not expect it, acne on places other than your face and that doesn't respond well to sort of the over-the-counter treatments, insulin resistance. So a lot of doctors will look at a woman and see, okay, no period, and do an ultrasound, and okay, there are a lot of follicles, so it must be PCOS. But HA needs to be ruled out first, and that's one of the things that's actually stated in the PCOS clinical guidelines. And a lot of doctors don't consider that. So they should be asking women, well, what's your eating like? What's your exercise like? Have you lost weight recently? And taking those factors into account as well. So in a woman who is in a small body and exercising a lot, I would never diagnose PCOS without the blood work or other physical symptoms, because HA can actually lead to what are called multifollicular ovaries. So you can have a lot of those small follicles on your ovaries with HA as well as PCOS. So unless the ovarian volume is more than 10 cubic centimeters, or you have more than, I think the current criterion is 26 follicles on one ovary, just because the ovary looks like it has a lot of follicles is not a reason to diagnose PCOS. I think it's really, really important to get the right diagnosis. I know some of your guests in the past have talked about ways that you should be eating differently to try and manage a PCOS diagnosis, maybe lower carb or whatever. But for somebody with HA, that's going to be completely counterproductive, because restricting food or increasing exercise are sort of the opposite of what you want to do to recover. The other thing is during the research that I did, I found some interesting ideas about managing PCOS. And one of them was a study where they found that eating 50% of your calories at breakfast actually had the same effect on sort of those PCOS-like hormones as taking metformin. And I thought that was really interesting, because metformin sounds like a pretty awful drug to be taking. And there are a couple of other medications, the chiroinositol, I think, and myoinositol, that also suggest that they can affect hormones positively, just like metformin, without some of the negative side effects. And so if there are listeners that have PCOS, I would suggest looking into some of those alternative things other than metformin for sure. But making sure that you have the right diagnosis between HA and PCOS, I think, is super important.
I think your comment about the ovaries and what you see on an ultrasound, I find that to be interesting from a perspective of a fertility awareness educator again, because it's almost like every time you get an ultrasound on your ovaries, there's something wrong. Like, oh my goodness, there's a follicle, or there's not a follicle, or there's lots of follicles. But if you understand what your natural, there is going to be follicles. So that's the thing. Like, that's the first thing we have to establish, is that when you're in your menstrual cycle, the first half of your cycle is when follicles develop. And before a dominant follicle, before Mother Nature decides which follicle is going to grow to maturation, there are several follicles that are developing at the same time. And so I often think it's interesting that a decision is made, or a recommendation for surgery is made, or these sweeping diagnoses on one ultrasound. Because just what you said in your own experience of that, you had one ultrasound done, there was one follicle, and you said, I wish they would have just waited a week. And that's exactly what I think of. I wonder why. And of course, I'm not an ultrasound tech and I'm not a doctor. So, but my question would be, well, if you see something at a certain point of the cycle, how can you make a definitive conclusion? I would wonder why you don't actually do a few ultrasounds over the course of that woman's menstrual cycle to see what it really is about. Is that just a stage of her normal development, or is it really a problem? Mm-hmm. So I just had to get that off my chest.
Yeah. So I think for PCOS, the ultrasound is usually done on cycle day 3, and then they have this idea that your ovaries should look like XYZ on that day. So if you have more than, like I said, I think there was a big study that a group of doctors did. I think it was in 2012, and I have the reference in that PCOS chapter in my book, where they looked at ultrasounds on hundreds of women and correlated it with the androgens and other signs of PCOS. And so it's based on that they sort of made this cutoff of 26 antral follicles per ovary is the diagnosis for them being, quote, polycystic. So that at least is based on a larger study. But yeah, I mean, I think that you're right that needs to be taken into context. And you can't just look at somebody's ovaries and say, oh, you have PCOS. That's not enough in my opinion. And even the people who wrote the paper on diagnosis, they list some conditions you have to exclude before you call it PCOS. But I think a lot of doctors aren't sort of aware of those caveats. And so they just see, oh, you've got a lot of follicles, and they don't bother to count them necessarily. And so therefore you must have PCOS, and here's some metformin, or come back and see me when you want to get pregnant. So.
Well, and then on the flip side, I'll just kind of put this out there where it's also possible to go to your doctor and have PCOS, but because you're not so for instance, if you're a woman, you're not overweight, you're young, you look really healthy, but your cycles are a little bit all over the place, as would be characteristic in PCOS. It's also possible that your doctor could completely dismiss the possibility that you could even have PCOS because they assume that if a woman has PCOS, they could be overweight. Or they have to, or they must naturally be overweight. And if they're not overweight, it must not be PCOS because they have a very particular idea of what a woman, what a PCOS client would look like or patient. So, so much, Nicola. So, I mean, we've talked about so many things during our time together. I know this episode is going to be really helpful for so many women, especially just really talking about what are some of the causes of hypothalamic amenorrhea and what are some of the factors that would contribute. One thing that we didn't spend a whole lot of time talking about is coming off of hormonal birth control. So I would love to hear your take on that and how that plays into HA.
So I'm not an expert on birth control pills and coming off them. So, this is not something that I've done a lot of research on. I did look at some papers, though, because of, the sort of general information that you get from your doctors that, it's normal for it to take 6 months after you come off the pill to get your cycles back. And one paper that I found that reviewed the scientific literature sort of debunked that idea and suggested that if you're your period within a few months, then you should start looking at other, at underlying factors like HA, for example. So in my case, my doctor really didn't want to do anything for 3 months, but if she'd taken a little bit more time with me at the very beginning when I didn't get that first post-pill period. I got it right after I stopped taking the pills, the normal withdrawal bleed, but then I didn't get another one a month later. And she could have looked at me then and said, tell me about your eating, tell me about your exercise, tell me about your stress. And, I could have made changes starting right then, as opposed to waiting for the 3 months because, quote unquote, you shouldn't expect it for 3 to 6 months after you come off the pill. That really seems not to be the case, and that, it is worth looking into other issues as soon as a month after you come off the pill, if you haven't ovulated or gotten a bleed yet.
Yeah, that's a tough one, because in my line of work, I know that you don't know why it happens for some women and not others, and you don't know why for some women, in theory, why it doesn't, why some women will get their periods back right away and why others it'll take longer. My understanding, there's a lot of factors there. So certain things, for example, how old were you when you first started taking hormonal contraceptives? How old are you now? How long have you been on it? What type of hormonal contraceptive were you on? There's a huge difference in how long it's going to take your period to come back if you were on the shot versus. So, and then there's the factors that are coming up with hypothalamic amenorrhea.
Oh, can I just
go ahead?
Can I just say, I really would like, people should not use the shot at all. The research that I've seen, hideous side effects from that in terms of bone density and everything else. So that is probably one of the worst methods of birth control that's out there, in my opinion. So just had to get that out. Sorry.
Oh, no. There was a study that I looked at, and it took an average of 17 months after coming off of the shot for a woman to conceive, for the women in the study to conceive. Yeah. And that's the average, just to be clear. The thing about it, though, is that if you're coming off of hormonal contraceptive, it's not realistic to expect your period to come back the first month after, because even in the research, it shows that that's not typically the case. It typically does take 3 to 6 months. And then, so it's complicated, but I am 100% there with you, Nicola, that we shouldn't just be like, so just wait. Because your menstrual cycle is the 5th vital sign of your health. So it's telling you that something's wrong. So if it doesn't come back and if it doesn't rebound, the solution isn't absolutely not to just wait. You really have to start looking into what's going on there. So couldn't agree with you more. Well, thank you so much for being here, Nicola. I realize we're at the end of our time here. We've spoken about a lot of things, but what is the one thing that you really want our listeners to take away from our conversation today, if there is one?
I think I have two, if that's okay.
Of course.
So first, I think it is so super important to get to know your own body and your own fertile signs. And I know this is how important it is, and understanding cervical mucus and how your body behaves during the cycle, and really using that as a barometer of your overall health, I think is just so important. So that's my number one thing. And then the second is, in terms of if you don't have a period, if really examining your lifestyle and your choices. And it can be incredibly difficult. It's easy for me to say, eat more and exercise less. It's an incredibly difficult thing to actually put into practice, because in a way you have to turn everything that you know on its head, because society tells us that exercising is healthy and, you want to be as thin as you possibly can and, eat, as little as you can to maintain that. And for women to stop following those strictures is really, really difficult. And it takes a lot of mental work and energy. But in the end, oh my gosh, it's so worth it, because, kids are amazing and it leads to a much more enjoyable life overall. And so, if you have any listeners that are in that situation, I really encourage them to check out my book, check out, I've got a Facebook group, support group for women who are going through this, to kind of build each other up and help them deal with these hard feelings. And so that's my number two.
Mm-hmm. Well, thank you so much for sharing that, Nicola. It was just a treat to be able to talk with you about your book and really kind of get into some of the most important factors. When you're talking about hypothalamic amenorrhea, it's really sad to think that we're at a spot where you go to the doctor and, even just to ask you, how have you been eating? What's your exercise routine looking like? Even those basic things to really check in with you, how you're doing. It's really sad that we're living in a time where that's not happening. So what that means is that we really have to take care of ourselves. We really have to take back that ownership of our own health. and use our menstrual cycles as a guide to let us know what's going on. Because, if you're not sure at the end of this podcast, like, am I exercising too much? Am I exercising too little? Am I eating too much? Am I eating too little? Once you get a handle on your menstrual cycles and you really are able to chart and sort out what a normal cycle is supposed to look like and where your cycle stacks up to that, you can really use that as a guide to what's happening. And if you have never done that before, it'll kind of blow your socks off just how much it's connected to what's going on.
Yep, absolutely.
Well, thank you again for being here, Nicola. It was so much fun to have you. Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/141. I hope you enjoyed my interview with Nicola Rinaldi. It was such a treat to be able to chat with her about hypothalamic amenorrhea, HA, and what is really at the heart of that and the root of that. And I was so happy to be able to chat with her about it, to really get at some of the misconceptions about it, and really just to talk about it and put it out there so that we can start that conversation. So many women struggle with hypothalamic amenorrhea, whether it is related to the timing of coming off hormonal contraceptives and not getting their period back, or whether it's related to something else, lifestyle factors, as we talked about on the show. And so I think it's really important to have that awareness that it's not just about diet, it's not just about hormones, it's about an interplay and a connection between all of these different things. And in our interview today, Nicola talked about a few things that are really, really important and really key to understanding why it is that your period may go away and what that has to say about your health and your fertility. And so in particular, she talked about restricted eating, which is just so incredibly common. After in our pre-chat, one of the things that I said to Nicola was that it's astonishing how disconnected we are from our bodies, so that even the very basics, when you're hungry, are you eating? Are you ignoring those signals? Are you counting calories? Even the concept of counting calories really disconnects us from our own feelings in our body, to eat when we're hungry and to not eat when we're not hungry. And there's so many different factors that affect appetite. We've spoken about a number of them on the show over the years. If you're not getting enough sleep, if you're going to bed late, or if you're having disrupted sleep, that actually triggers a hormonal response that makes you more likely to crave carbs at night than the night following. So for some people, just making sure to get adequate sleep at night in the dark can be a huge factor in weight loss. If you're trying to lose weight, it's really tempting to get on that train and think that you need to restrict calories and increase exercise. But it turns out that is an evidence-based approach. The literature supports it. It's not the way to go. So if you haven't listened to the episode that I released with Dr. David Brownstein and Dr. Dennis Wilson, it was kind of like a 2-for-1, where I included 2 interviews that I did live at the Restorative Health Conference here in Toronto. It's something that Dr. Wilson speaks about in his research, and I'm really excited. I'm going to have him on the show again to delve deeper into those topics, because we only had a short time to talk about it. But I'll direct you to episode 124 to listen to the second interview on that episode, which was the interview that I recorded with Dr. Wilson. And he does talk about weight loss and why it is that exercise and caloric restriction doesn't actually work, especially in the long term. It's such an individualized thing to really try to figure out how much exercise is right for you, how much could be too much, if you are exercising too much or too little. The first thing that I would invite you to do is just to have that on your radar, that it is possible that if you're going to the gym 4 or 5 times a week and working out, for an hour a day, every day, that it is possible that for you that could be too much. And then, as Nicola talked about in the podcast, if you are combining that exercise routine with under eating, so if you're combining your exercise regimen 4 or 5 days a week with restricting calories and reducing the amount that you're eating each day, that is a recipe basically to stress out your body and to increase your stress hormone levels. And that in of itself can negatively impact your period. It can actually make your period stop. And also, looking at your body weight, looking at your stress levels, and looking at your own unique susceptibility. So you may wonder, you may even have a friend in your life who does basically the same thing, where they work out all the time and they, maybe they, depending on how they eat, I don't know. And, their periods are always perfect and healthy. To that, I think two things. One, I think I would want to see the actual parameters. Lots of women have cycles that are quote unquote regular, but it doesn't mean that all the parameters are healthy. But the second thing that I'd want to say is that we all have our own unique sensitivities and our own unique areas that we just are a little bit weak than some of our friends. So whereas some of us can eat gluten every single day, we can eat bread and wheat, and it makes absolutely no difference in our cycles and our health. There's some of us that can barely have any, and it has a entirely detrimental effect on our health. And I've seen it in my clients when we take a look at their menstrual cycle charts. So whereas one woman has completely healthy charts, healthy mucus, healthy parameters, and she eats a moderate amount of wheat and bread in her diet. I'm just picking on bread for the example. And another has a little bit of bread and her cycle just goes completely haywire. So we all have different sensitivities. Some of us have weaker gut. Some of us have a little bit more challenge with our immune system. Some of us have different challenges with respect to how we keep and put on and hold weight. And so it's really important to honor those differences. And that's where the menstrual cycle is, in a way, the grand equalizer. Because if something is affecting your health, if something is affecting your fertility, it'll show up there in your cycle in a number of different ways. And so you can really use that as a tool to figure out what's happening with you, what you're sensitive to, and then make those adjustments as necessary. And just as Nicola said in our episode today, if you are trying to figure out how much exercise is too much for you, from my perspective, the first place to look is your menstrual cycle. So, if your menstrual cycle is not healthy and you are, so for instance, and what I mean by not healthy, if you're not ovulating regularly, if your luteal phase is really short, or if we're seeing mucus patterns that there are a number of factors that we look at to determine if your menstrual cycle is healthy. And so if those factors are off, then it's not necessarily one specific thing that could be the problem, but that's where we start the conversation. And then you're able to kind of do these tests cycle by cycle. So if your markers are off and your cycles are not healthy and you're exercising, 5 times a week, you're basically exercising every single day, then the beauty of this is that we can back off for a month or two, try something different, and then see how your cycles respond. Similarly with your eating habits, if you're not getting enough to eat, and then you make some shifts and you eat healthier foods in sufficient quantities. So focusing on whole foods, real foods, vegetables, clean meats, and healthy fats. And, if you're really focusing on those things, then you can do a little trial where you can see if you make certain shifts in your diet and incorporate enough nutrients in what you're eating to see how it impacts your menstrual cycle health. And then you can actually use that as a gauge from one cycle to the next. And that is what will give you that window and insight into what's happening in your cycles and how your body's reacting and what factors could be preventing your period from coming back. So that was a bit of a ramble. I didn't intend to talk that long, but such is life. This is what happens because I always have a lot to say. But I hope that you did enjoy today's episode with Nicola. So make sure to head over to fertilityfriday.com/Cora to check out our show sponsor. And you can also give them a shout out on Twitter or Instagram or Facebook just to thank Cora for supporting the show. And of course, if you are looking for additional support with your charting and you're just wanting someone to kind of walk you through the process, definitely check out my Work With Me page, fertilityfriday.com/workwithme for more information about how we can work together. And I just want to thank you for hanging out with me today. I appreciate all of you for taking the time to tune into the show. There are so many options, so many shows, so many podcasts that you could be listening to, but you're hanging out with me today and I really appreciate it. So I just want to thank you again. And as always, until next time, be well and happy charting.